Same questions like what is the simplest indicator of mortality? Next two things are very important. Don't make mistake in between these two things. Proportional mortality rate and case fatality rate. See the words. If I want to know contribution of a disease in terms of mortality, what indicator is used? Answer my question. If I want to know contribution of a disease in total mortality, what indicator is used? Proportional mortality rate. See the formula. Denominator total deaths. Like you can imagine a pie chart. Denominator total deaths. In that, I want to know the contribution of a disease. For example, I want to know the contribution of tuberculosis. That is what is there in the notes. Deaths due to a disease divided by total deaths. So you can use pie charts for this because it is proportion. What you are using, the indicator proportional mortality rate is a proportion. So this will indicate the cause of death or the most common cause of death in that population. Tell me true or false. Type it in the chat box. Good. True or false. What is your answer? It will indicate most common cause of death. When you are plotting it on a pie chart, if the contribution is more, that disease will contribute more, that will become the most common cause of death. Usually cardiovascular disease, heart attacks, mortality is more. Nowadays, if I am asking, good, true statement, correct, true statement, yes. Which is the mortality indicator which indicates burden of a disease? Whatever the disease which comes and that becomes the most common cause of death, that will become the burden for us. So what is the mortality indicator to indicate burden of disease? What is your answer? Tell me. Good. Yes, correct. Burden. See my words properly. Everything is written there. I am asking the same thing. Which is the indicator to indicate burden of disease? Means mortality indicator I am asking. Proportional mortality rate. Proportional mortality rate. But if the question is like this, which is the indicator to indicate severity of disease? What is your answer? Severity, killing power, virulence of agent, dangerous. How dangerous is the agent? If such words come, what is the answer? Case fatality rate. Case fatality rate. Like the denominator will be cases, numerator will be death. Out of 100 cases, 50 will die. For example, I am asking, out of 100 cases, 50 will die. What is case fatality rate? Answer my question. Very good. Out of 100 cases, 50 will die. What is case fatality rate? 50%. You can use a pie chart. It is also a proportion. You can make pie charts for both proportional mortality rate and case fatality rate. Case fatality rate will indicate how dangerous is the disease. So if they ask, match the following, simplest indicator of mortality, crude death rate. Mortality indicator for burden, proportional mortality rate. Severity or killing power, if they mention this word, it is case fatality rate. Usually we ask questions on 1, 2 and 3. If at all they frame questions on each standardized death rate and standardized mortality ratio. We have discussed standardized mortality ratio in the classes in detail. One short session is giving more of the content in a crisp way. Listen to my words properly. Two different populations are there with different age structure. Listen to the words properly. Two different populations with different age structure means one population is having more old age individuals because of their development. Lifespan is better. One population is having more old age individuals means what is the difference in between them? Answer my next question. Two populations with different what? Answer my question. Good. One population, one more population. Yes, one population is having a higher old age individuals. Because of that, there is a difference in age structure. Yes, see the words properly. Age structure. What can be used to compare mortality in between these two populations? If they ask, crude death rate should not be used. Remember this word. Crude death rate should not be used. In such situation, in such scenario, we have to do one standardization. What is that standardization done called as direct standardization? Listen, they won't ask calculations for you. Everything will be in sentence mode or word mode. Calculation is not necessary. So whatever is asked, if you are answering it in a correct way, that is the purpose. So main thing is purpose. What we have should be fulfilled. Listen to the words properly. What standardization is done? Direct standardization we do. Taking the rates, each specific death rates of two study population. Each specific death rates of two study population is applied on one standard structure. Listen to the words. Each specific death rates of two study population is applied on one standard population. Means we are neutralizing the effect of that age structure. Tell me yes or no. You are neutralizing the effect of that age structure. See the words what I am using. Tell me yes or no. Yes, because you are taking one standard population. We are applying the age specific death rates of two study population on one standard population. This is direct standardization. This is direct standardization. When you do direct standardization, we get each standardized death rates. Okay, good. When you do direct standardization for age, we are getting age standardized death rates can be used to compare mortality between two populations with different age structure. I want everyone to type it again. What is the indicator which can be used when there are two populations with two different age structure? I want to compare mortality. What is the indicator used? 1 mark 100% question. If they ask, if you mark it correct, one short session, you will remember this. And there was a question on this if they ask, and if you mark it correct, good, you can put one smiley on this. Age standardized death rates. Okay, now come to the next question. Compare mortality between occupation and general population. If I am asking this word occupation, anything like coal workers who work with coal, miners, is having more risk of death compared to general population. I want to give more incentives for them. I want to give more incentives for them. What ratio? Answer my question. Have some patience. What ratio is used to compare mortality between an occupation versus general population? So what is your answer? What ratio is used? Standardized mortality ratio. Don't mark odds ratio. Odds ratio आपका फेवरेट है. मतलब आपको ऑप्शन में ऑड्स रेशियो देखते ही आपको मतलब इट विल लाइक इट इज लुकिंग लाइक ए वाओ, देन यू विल बी मार्किंग ऑड्स रेशियो. डोंट डू दैट. आंसर इज mortality ratio. What is that mortality ratio called as? Standardized mortality ratio. Repeat my words. I want everyone to type it in short. SMR. Standardized mortality ratio. Standardized mortality ratio. Oh, what is the standardization done if they ask? Listen to the words properly. Listen to the words properly. Observed deaths will be given. Example I am telling 9 per 1000. I want expected deaths in that occupation. Expected deaths is calculated by indirect standardization. Listen, tell me the formula. Good. Repeat the formula. O by E. I want everyone to type it here. O by E. It's more about the output after the class. That is more important for me. If you are giving input, output will come. Again I am telling. So type it in the chat box. O by E is the ratio. O by E is the ratio. Observed deaths by expected deaths. Yes. Observed deaths is already given. How much is the observed deaths? Answer my question. Observed deaths is already given. How much is the observed deaths? 9 per 1000. What I want to calculate standardized mortality ratio. What extra I want to calculate standardized mortality ratio? I need expected deaths. That is calculated after indirect standardization. That is calculated after indirect standardization. What we do in indirect standardization is taking the rates of coal miners, each specific death rates of standard structure. Listen to the words properly. Each specific death rates of standard population is applied on study population. What is the study population we are using? Tell me. Coal miners. Each specific death rates of standard population is applied on study population. This is completely ulta. Each specific death rates of standard population is applied on study population. Study population is coal miners, coal workers. Yes, good. We get expected deaths after indirect standardization. Expected deaths, for example, I'm telling 7 per thousand. Expected deaths, for example, I'm telling 7 per thousand. If I take the ratio 9 by 7, it is more than 1 or less than 1? Answer my question. 9 by 7 is more than 1 or less than 1? 9 by 7, more than 1 or less than 1? Yes, good. More than 1, more than 1, more than 1 means occupation is having more risk of death or less risk of death? Occupation is having more risk of death or less risk of death? Yes, occupation is having more risk of death. This question they will ask in the exam. Mark these two things. I'll give the PDF for you. You can check the videos again, once again, before the exam. Use PSM one shot session, just video in 1.5 mode or 2 mode. You will be getting good output. Listen, 1 2 3 4 5 mortality indicators we discussed in this slide. Tell me yes or no. 5 mortality indicators we discussed in this slide. Tell me yes or no. Yes sir, good. 6:15, 15 minutes for mortality indicators. We are on time, good. Chasing is very important, that too in one short session. Na? Morbidity indicators, incidence and prevalence. Morbidity indicators, incidence and prevalence. Yes, good. Incidence means new cases will happen in the future. English word, incidental finding. Incidence means new cases will happen in the future. What is the denominator you have to take? Population at risk. What is the denominator we have to take? Population at risk. Yes, not everyone. We have to take only those who are at risk of developing disease. Already having disease, we have to exclude them. Population at risk in the denominator, new cases in the numerator. That means we have to do follow-up. To get new cases, follow-up should be done. Tell me true or false. Answer my question. Follow-up should be done. True or false? True statement. What studies we do follow-up? यहाँ से शुरू होके वहां तक जाएगा ना, मतलब we start here and we give some time. We have to search for something. We have to wait. Patience is very important in life. If you don't have patience, you might become patient mentally. Usually I'm telling, patience is very important. Cohort study. IPL season है ना, थोड़ा सा excitement ज़्यादा हो गया. Cohort study, follow-up should be done. Underline this word, follow-up. Cohort study will give incidence. Cause we start, effect we get. Smoking we start, we get lung cancer in the future. Smokers to lung cancer. Smoking, risk factor to disease. What is this association called as? My favorite word in the class. Yeah, very good. What is this word? What is this word? Temporality. Temporal association is the most important criteria to prove etiology. True or false? Temporal association is the most important criteria to prove etiology. True or false? True statement. We have to prove temporality. That is why incidence will help in studying etiological hypothesis. Tell me true or false. Answer my next question. Incidence will help in studying etiological hypothesis because you are starting from a smoker. Or for example, non-alcoholic like me, if I drink alcohol later, if RCB is not winning the cup, example I'm telling, it will happen. If I start drinking alcohol, then after 10 years continuously, I know they will not win the cup. That is why every year I'm drinking, every day I'm thinking about that and drinking. Later, after 10 years, if I develop liver cancer, Isala cup namde, what is this association called as? Answer my question. Temporality. It's very important. Non-alcoholic, then alcoholic, then liver cancer. It is temporality. So incidence will help in studying etiological hypothesis. True or false? Answer my question. Incidence will help in studying etiological hypothesis. True or false? True statement. Always keep this word risk with you. Risk is always calculated during follow. Risk means someone is normal. In the future, if he is developing disease, that is called as risk, not burden. Incidence will measure risk of developing disease. Tell me true or false. Answer my question. Incidence will measure risk of developing disease. Tell me true or false. True or false. True statement. Always keep this word risk with you. It will not depend on duration of illness. I will tell the equation later. What will depend on duration of illness? Tell me. P is equal to I into D. I am asking. What will depend on duration of illness? Existing cases. What is that called as? Open the notes. Yes, good. In class notes I am telling. Whatever the notes you are having, this equation should be there in the notes. Any PSM notes I am asking. What is this equation? P is equal to I into D means prevalence. What is present? Present tense. Prevalent. Existing cases at one point of time. You go to a class, you do a study. That study is called as cross-sectional study. Yes or no? Study is done at one point. Temporality cannot be proved. Cross-sectional studies can be used for etiological purpose. True or false? Answer my question. Cross-sectional study. Cross-sectional study cannot be used for etiological purpose. True or false? See the words properly. Cross-sectional studies cannot be used for etiological purpose. True or false? False statement. Why you cannot use for etiological purpose? Why you cannot use for etiological purpose? Why you cannot use for etiological purpose? See the words. Cross-sectional studies cannot be used for etiological purpose. What is the reason? Temporal association is not proved. Temporal association is not proved. Yes, no follow-up. Correct. Yes, correct. No follow-up. Yes. Yes, snapshot. It is prevalence. There is no follow-up. But whatever the cases we are having, it will indicate burden of disease. Tell me yes or no. Prevalence is morbidity indicator for expressing how many are having disease. Burden of disease. Tell me true or false. Prevalence will indicate burden of disease. True or false? True. Now match the following. Yes, correct. Very good. Now match the following. Risk of developing disease. What is used? Risk of developing disease. What is used? Incidence. Burden of disease. What is used? Prevalence. Prevalence means existing cases. English word. Incident means something will happen in the future. Prevalence means prevalent, present tense. Good. What is this equation? P is equal to I into D. I want everyone to type in the chat box PID. Prevalence means existing cases. What is there in the tub? Don't write all this. Tub, bathroom, toilet, commode and all. No, it is not the way. If I am asking this, existing cases, prevalence. Inlet is new cases, incidence. Existing cases is prevalence. Inlet is new cases, incidence. Outlet is two things, cure and death. These two things will reduce prevalence. Tell me yes or no. Cure and death will reduce prevalence. Tell me yes or no. Cure and death will reduce prevalence. Tell me yes or no. Yes, good. That means if the disease is easily curable, highly fatal, prevalence will be less. Prevalence is more for chronic diseases. Tell me true or false. Prevalence will be more for chronic diseases. Tell me true or false. Very easy question I'm asking. Long-standing illness, diabetes, hypertension, these things will be having more prevalence. Prevalence depends on duration of illness. Again I'm asking true or false. Listen to the words properly. Most of the questions which I ask in one short session will be true. Listen to the word properly. I'm telling one secret for you. Small secret what I'm asking is, most of the questions what I'll be asking in my regular batch will be false. But most of the questions what I ask in one short session will be true. Not everything, most of the questions I'm asking. Yes, good. I'm telling that secret what you got. A new effective treatment for cancer. Like surgical intervention, surgical intervention. Yes, good. Answer my question. What will happen because of surgical intervention? You are giving cure. You are giving cure. Already having cancer. Already having cancer. Yes. Beach mein one or two googlis I put. Not always. Listen. Cure for cancer. What will happen to incidence? Listen to the words properly. Cure for cancer. What will happen to incidence? Yes. What will happen to incidence? You are not doing anything for incidence. Incidence no change. Incidence no change because you are not preventing anything. You are not preventing anything. Prevalence will decrease because existing cases will come down. Tell me yes or no. Tell me yes or no. Yes ka matlab smiley. Like this you can put. If I am asking yes question, the response for yes is like this. One smiley you are putting. That smiley good. Yes or no. Existing cases will decrease because you are doing curable intervention for cancer. Listen to the words properly. See the diagram. Everything is self-explanatory there. You're not preventing anything. You're not preventing anything. Yes, good. Now the question is different. A new treatment for cancer. See the words properly. Prolonging the survival. What happens to the duration? If you are not giving any cure, patient is living for a longer duration. Now answer my question. What happens to the duration of illness? What happens to the duration of illness? What is your answer? Good, good. Duration is prolonged. Duration is prolonged. If the duration is prolonged, prevalence will increase. Last year prevalence was 5%. This year prevalence is 10%. Then the health minister will ask one question to you. You are public health specialist. What you are doing? You are not doing anything. You have to explain to health minister properly. You cannot go in detail to them. PID, D for duration and all. That will take so much of time for them to understand. Tell them properly. We are doing something good. So trust us. There is something called as trust and belief. We are doing something good. What is the reason? Duration is prolonged. Prevalence will increase. Tell me yes or no. Duration is prolonged. Prevalence will increase. Yes or no. This question will come. Duration is prolonged. Prevalence will increase. Yes or no. Yes, 100%. Incidence don't change. Prevalence will be increased. Bhai ka bharosa. Underline this word. Prevalence will increase. They will ask this question. 100% question. Mark this question. When you are listening to the video, I'll be giving the PDF for you. Again, go back to the PDF what I'm giving. Just keep on annotating. Yes, listen. There is a difference in the question. First question was effective treatment for cancer. Second question was new treatment for cancer, prolonging the survival. There is a difference between two questions. Tell me yes or no. There is a difference between two questions. Tell me yes or no. Yes, and read the question properly in the exam. Don't directly jump and don't directly mark whatever you want. Have some patience, relax, आराम से. Offside ball, offside मारना है. Leg side ball, leg side मारना है बस. Ball is coming to the wicket. Either you do defense or put some, what is that, straight drive. Underline this word. Communicable disease. Communicable disease. TB patient is getting cure. Transmission is reduced. Tell me yes or no. Transmission is reduced. Tell me yes or no. TB patient you are treating. Yes, very important. Transmission, contacts, risk of getting disease in the contacts will be lesser. Tell me yes or no. You are reducing the transmission. Because of that, incidence will decrease. If I is decreasing, P will also decrease. So both will be decreased. Tell me yes or no. Both will come down. Tell me yes or no. New treatment for a communicable disease. Both will come down. Come down. Underline this word. Don't make mistake. I will also come down. B will also come down. Both I and P will decrease. Yes. Question number 1. Question number 2. Question number 3. A new prophylactic intervention. Something which is preventive. What will happen if you are preventing new cases? What is the main thing which will decrease? Tell me yes or no. Incidence will come down. Incidence will decrease. Always keep this in mind. If I is decreasing, P will also come down. So something which is preventive, vaccine, yes, immunoprophylaxis or chemoprophylaxis, both will reduce. Both will reduce. If I want to check the impact of a preventive intervention, see the words in the notes. impact of a preventive intervention, which is a better indicator. See the words properly. Impact of a preventive intervention, which is better indicator. Both will come down, but my question is like this. Impact of a preventive intervention, which is a better indicator, incidence will be the better indicator to check the impact. Yes, because prevalence will take some time. We always keep incidence as the impact indicator for any prophylactic intervention. Yes, obviously the equation is P is equal to I into D, na? What is that equation? P is equal to I into D. So if I is coming down, P should also decrease. That will take some time, but it will come down. So question number 1, 2, 3, 4. 1, 2, 3, 4. Very, very important. I want you to type 1, 2, 3, 4 questions in this slide. Good. Come to the next slide. 6:30. Yes, we are on time. Good. Listen to the words properly. Yes, good. Index. Human Development Index is used to compare standard of living between countries. Tell me true or false. Answer my question. Human Development Index is used to compare standard of living between the countries. Tell me true or false. Standard of living. Standard of living. Yes. Income is considered true or false. Next question. Income is considered true or false. Next question. Income is considered true or false. Next question. True statement. What are the dimensions? What is a mnemonic? Knowledge, income, and longevity. This is how life. First we have to know something. If I have knowledge, then they will give job. I will start earning something. See, without knowledge also you can earn, but my question is like this. It is a sequence. It is how life will go. Knowledge, then comes income. You will get a job, you will start earning. After knowledge and income, you have to live. Living is also very important. You have to enjoy the life. Na? Enjoyment means smiley. This is Human Development Index. Depending on the country, the mnemonic is skill, knowledge, income, and longevity. Within knowledge, two indicators are used. Mean years of schooling and expected years of schooling. Depending on the dropout rate, we calculate expected years also. Literacy rate is not considered. Listen to the words properly. Literacy rate is considered now. True or false? Answer my next question. Literacy rate is considered now. True or false? See the words properly. Literacy rate is considered true or false? Literacy rate is considered true or false? False statement. Literacy rate is not included. Long back before 2010 when they used, literacy rate was included. Now we are not having literacy rate. What are the two indicators? Mean years of schooling and expected years of schooling. Mean years of schooling and expected years of schooling. Yes. Depending on the dropout rate. Depending on the dropout rate. Within income, what is the indicator used? Per capita GNI. It is not GDP, it is GNI. Repeat, per capita GNI is used as an income indicator. Tell me true or false. Per capita gross national income is used as an income indicator. True or false? True statement, yes. True, important. Gross national income means whatever the extra help we get from foreign countries, that is also included. Along with what we produce, GDP, extra help what we get from foreign countries, that is also included. Life expectancy, when you count, it is life expectancy at birth. Life expectancy at birth. That means every dimension is given equal 1/3 importance. True or false? Every dimension is given equal 1/3 importance. True or false? True statement. Equal importance सबको मिलेगा. फिर उसके बाद after that we calculate geometric mean. Human Development Index is geometric mean. True or false? Next question. Human Development Index is geometric mean. True or false? Human Development Index is geometric mean. True or false? True. Always keep in mind. I will ask this question. हर एक डायमेंशन को 1/3 इंपॉर्टेंस, फिर उसके बाद when I calculate mean, every dimension is given equal 1/3 importance. When I calculate mean, it is geometric mean. Kill. PQLI, income is not included. Always keep in mind, income is not considered. PQLI, income is not considered. What are the other three things? IMR, literacy rate, life expectancy from age 1. Life expectancy from age 1. So the mnemonic is ill. ILL. Mnemonic is ill. Infant mortality rate, literacy rate, and life expectancy from age 1. Because IMR is given separate importance. So whatever the life expectancy we count will start from age 1. Regarding that, we calculate PQLI. Based on that, we calculate PQLI. So what is the mnemonic for HDI? Kill. Yes, kill. Then comes ill. ILL. Kill ill. Kill ill. Kill Dil movie tha na? Oh, very old movie. Kill Dil, I think. I have stopped watching movies anyhow, but there was a movie called as Kill Dil long back. Multi-dimensional poverty index indicating poverty. PQLI will indicate quality of life. True or false? Next question. PQLI will indicate quality of life. True or false? PQLI will indicate quality of life. True or false? True statement. Poverty, if I want to compare, you will be using multi-dimensional poverty index. Human poverty index is not used now. Remember this. Human poverty index is not used. What is the mnemonic for this? Hell. Remember like this. Health, education, living standards. Poverty, hell, heaven. Poverty, hell. Remember like this. Health, education, and living standards. Within these three dimensions, there are total 10 indicators, 2 to 6. So multi-dimensional poverty index will have 3 dimensions and 10 indicators. Tell me true or false. Next question. Multi-dimensional poverty index will have 3 dimensions and 10 indicators. Tell me true or false. 3 by 10. I want everyone to type this. 3 by 10. 3 dimensions and 10 indicators. 3 dimensions and 10 indicators. Yes, good. Very good. Good. Yes. Tell the mnemonic. If by the time you are telling the mnemonic, I'll be putting one smiley in my slide. Go tell the mnemonic. Kill. Okay. Ill. Anji. H-E-L. Hell. Kill. Ill. Hell. Health. Education. Living standards. Health. Education, living standards. So usually they will ask how many dimensions and how many indicators. How many dimensions and how many indicators. Yes, good. Correct. So no need to write anything. Just listen to the class, answer my questions. And the way you are responding is very good. Awesome. Overplay was very good. Actually, we finished almost half an hour, 30-35 minutes. And the response what you are giving is very good. For that I am putting one smiley in the chat box from my side. Good. Thank you so much for this. Underline the next word. 1, 2, 3. Very important. 1, 2, 3. Dailies. Disability adjusted life years. What is the use of this indicator? Burden of disease. Very important. Burden of disease. So listen to the words properly. Starting from birth, living till this limit is called as standard life expectancy. Yes. From which country we take standard life expectancy? Answer my next question. Japan. Japanese life expectancy is taken as standard. So starting from birth till death, that is standard life expectancy. From Japan we take standard life expectancy. Yes, very good. Yes. Now listen to the words properly. If I am asking, for example, I am asking if the standard life expectancy is 80. Example I am telling. No need to write the values. No need to write anything. Everything has been taught in the class, and one short session will be a revision session for you. Listen. 80 years if it is the limit. Example I am telling. If I develop arthritis at 50, die at 60, how many years lived with disability? Tell me. If I see, it's standard life expectancy. India will not, we are not using national life expectancy for dailies. No, it is standard life expectancy what we use. 50 years if I develop arthritis. If I die at 60, so YLD, it's around 10. Don't write any value. We need disability weight also. Based on that we calculate YLD. Now tell, if the death happens at 60, how many years of life lost? If the death happens at 60, how many years of life lost? How many years of life lost? 50, I develop arthritis, I will die at 60. Example I am telling. I will develop 60 years. I will die at 60, then 20 years of life lost. We are adding both. We will give dailies. What is the formula for dailies? Right, next line. Type it in the chat box. What is the formula for dailies? YLL plus YLD. YLL plus YLD. So this will indicate dailies for this individual. In the same way, we are counting so many individuals with arthritis. There are so many individuals with arthritis. We are counting two parameters. What are the two parameters we consider? YLL and YLD. Based on the mortality at the same time disability pattern, dailies will include both mortality and disability together. Tell me true or false. Next question. Dailies will include both mortality and disability together. Tell me true or false. Yes, yes, correct. YLL and YLD. Out of YLL and YLD, which will indicate premature mortality? Which indicator will indicate you are not reaching the limit? Which indicator will indicate premature mortality? This is my next question. Which indicator out of these two will indicate premature mortality? YLL, very good. Years of life lost due to premature death. Tell me true or false. Next question. Years of life lost due to premature death. Tell me true or false. Years of life lost due to premature death. Tell me true or false. True, true. Very good, good. Premature death, because what is that life expectancy we use and take it as a standard life expectancy, that is from Japan. Based on that we calculate YLL, years of life lost due to premature death. More the dailies, more will be the burden of that disease. Tell me yes or no. If the dailies is more, burden of disease is more. Tell me yes or no. For example, A and B, if I compare, A 60 dailies, B 80 dailies, which is more burden? Which disease is having more burden in the community? Disease A 60 dailies lost, disease B 80 dailies lost. Which disease is having more burden comparatively? B is having more burden compared to A. Very good. Yes, this is the summary of dailies. I have covered all the points. This is a summary of dailies. Now come to QALYs. Tell me the full form. Quality adjusted life years. Quality adjusted life years. To tell how good is the intervention, what indicator is used? Next question. To tell how good is the indicator or intervention what you are using, what indicator is used? QALYs gained by the intervention. QALYs given, QALYs gained. How much quantity and how much quality that intervention is giving? Quality of life is given by utility value. Open the notes and tell quality of life is given by utility values. How good is that intervention? Sirf quantity is not important. Quality is also important. quality is calculated by what value? I want you to type one word in the chat box. This word was asked in NEET PG 2023. This was in the notes, and by seeing this, every student mark this. One mark, when most of them they are not marking, and if you are marking will create a huge difference. I'm telling. I want everyone to type this. Utility value, yes. Quality of life is given by utility value, yes. UV, utility value is used in Qualis calculation. True or false? Next question. Utility value is used in Qualis calculation. True or false? True statement. True statement. Yes. For example, I am telling there are two interventions for a disease. There are two interventions for a disease. Intervention A and intervention B. Listen to the words properly. Intervention A and intervention B. One side I am putting intervention A, the other side I am putting intervention B. Quantity given by these two interventions is almost same. 4 and 4. 4 years of study. Now which value will decide which intervention is better? Next question. Very easy question I am asking. Quantity दोनों तरफ same है. 4 years, 4 years. Now tell me which value will decide which intervention is better. Very, very good. Again, I want you to type that value, utility value, depending on the study, how the patient was feeling. We have a questionnaire. We calculate utility value. We calculate utility values. For example, utility value for this A is 0.9, B is 0.5. Utility value for A is 0.9, for B is 0.5. Then when you calculate 4 into 0.9, 3.6, 4 into 0.5, 2. Which is a better intervention? Which is giving more Qualis? Answer my next question. 4 into 0.9, 3.6. 4 into 0.5, 2. So which is a better intervention? A is better than B. A is better than B. Yes, very good. Qualis, when you calculate, it will consider both quantity and quality of life given by that intervention. Tell me yes or no. Very, very good. Put one smiley here. Yes, we finished Qualis also in a concise way. I covered each and every point. Yes, sir. Yes, sir. Good. Yes, sir. Good. Dailies lost will indicate burden of disease. Qualis gained will indicate how good is the intervention. How good is the intervention. 1 dailies, 2 qualis. Third is health adjusted life expectancy. का मतलब something will happen in between. Life का मतलब it's not always the same thing. Some negativities will happen. Physical disability. Sometimes we include mental disabilities also. We have to subtract all those negativities. We have to subtract all those negativities. Whatever is left in the life, that is taken as health adjusted life expectancy, means how many years we can live in full health. Highlight this word. How many years we can live in full health. What was the older names given to this word? Tell me, what was the older name? We count only positiveness, means we remove all the negativities. Yes. What was the older name given to this? Disability free life expectancy. Sullivan's index, that has been updated now to Dale. Disability adjusted life expectancy, that has been updated, and we call it as health adjusted life expectancy. Means we are getting an update 1.0, 2.0, 3.0 like that. Health adjusted life expectancy. Highlight this word. If the disability pattern is more, hail will be less. Tell me true or false. If the disability pattern is more, health adjusted life expectancy will be lesser. Tell me yes or no. Yes, sir. Very good. Good. Health adjusted life expectancy ka MCQs we have covered. whatever they might ask in the exam. Can I ask one more thing from you? Can you do one more favor for me? Can you type all these three words in the chat box? One is days. Yes, sir. Second is qualis. Present, sir. Third, health adjusted life expectancy. Bandidini, sir. Yes, very good. Dailies, qualis, and hail. Disability adjusted life years. I want the spelling also, but don't type Dale and all. It is dailies, polis, and Hale. H-A-L-E. Very good. Good, 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 good. Very good. Come to the next question. So, attack rate means how many new cases will happen during an epidemic. Always keep this word. Writing an epidemic report is very, very important. When you write any epidemic report, we have to express the number of cases in terms of attack rate. Out of 100 cases, for example, I'm telling, out of 100 at risk, 20 new cases develop. What is attack rate of this epidemic? Tell me. Out of 100 at risk, 20 new cases developed. Out of 100 at risk, 20 new cases developed. What is attack rate? 20% is the attack rate. 20% is the attack rate. This is how the question comes. Epidemic investigation you are going. How many new cases will happen that you are calculating? 100 in the denominator. Out of 100 at risk, 20 new cases developed. Calculate attack rate of this epidemic. Very easy question. Attack rate. We don't use the word incidence during epidemic. Whenever the word epidemic comes, what we need to use? Type it in the chat box. Whenever the word epidemic comes, when you're writing an epidemic report as a public health specialist, what word we need to use? Attack rate. Attack rate. What is the indicator to show communicability within the family, within close contacts? Next question. Communicability I want to assess within close contacts, usually family members, within the family. What indicator is used? These are all very basic questions. Don't make mistake in this. What indicator is used? Secondary attack rate. Secondary attack rate. Yes, good. For example, one primary case was there. 3 susceptibles was there. Later, after exposure to one primary case, out of 3, 2 secondary cases developed. Out of 3 susceptibles, 2 secondary cases developed. What is secondary attack rate? Tell me. Very basic question I am asking. Just I am using whatever is necessary for one short session. In such a way I am making it more concise, crisp. Tell me good. Yes, 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 yes. This is the primary case which happened in the family. Whatever happened later is secondary cases. Out of 3 susceptibles, 2 secondary cases developed. Secondary attack rate is 66%. Very good. Secondary attack rate is 66%. Yes, very good. Now listen to the words properly. Primary case is excluded. Tell me true or false. Primary case is excluded. Tell me true or false. Primary case is excluded. Tell me true or false. Yes, good. True statement. We are not including primary case because we are assessing communicability of primary case only. So we are not including primary case. Very good. So if they ask within close contacts, we are using secondary attack rate. One case will generate how many cases? In a completely susceptible population means a new disease will come. For example, COVID. One case is generating, example I am telling, 2 cases in the community. What is basic reproduction number of this disease? Answer my next question. Everyone is susceptible. New disease will come. Like COVID for example. One case is generating 2 cases in the community. It is how the disease is spreading, transmission in the community. One case is generating 2. That means what is basic reproduction number? R naught. R naught is 2. Yes. If R naught is 4, 5, 6, it's very difficult to control the disease. Lockdown, social distancing, All those preventive measures like double masking will help in reducing basic reproduction number. Tell me true or false. Lockdown, social distancing, double masking, yes, all these precautionary measures will help in reducing basic reproduction number. Tell me true or false. True statement, very, very good, yes. If I am telling this word, instead of completely susceptible, I change that into like this. How the disease is spreading in a mixed population, what number is used? Answer my question. If I am telling how the disease is spreading in a mixed population, some are immune, some are still susceptible. In such situation, what number is used? Effective reproduction number. Effective reproduction number. Yes, good. Listen, 1, 2, 3, 4. Don't make mistakes in these indicators. Don't make mistake in such indicators. Yes. Now the definitions, what they are asking, very easy things. Don't make mistake in the definitions also. This second chapter, what I am covering some basic points in this. Incubation period is between exposure to first sign or symptom. Means you are detecting clinically, clinical detection. What is the gap between exposure to serological detection called as? Answer my next question. What is the gap between exposure to serological detection called as? Answer my next question. Exposure to clinical detection is incubation period. But if I am framing the question like this, exposure to serological detection, what is that called as? Window period. That is different. Window period. Yes. Clinically, it is incubation period. Lab detection, serological detection is window period. Starting from exposure, how much time it took for 50% of the cases to develop? See the words properly. After finishing the outbreak, out of the total number of cases, will take 50%. After exposure, how much time it took for 50% of the cases to develop? See the notes. 50% of the cases to develop. What is that time called as? From exposure to 50% of the cases. Median incubation period. Median incubation period. Yes. Exposure to maximum infectivity. Exposure to first sign and symptom is incubation period. But exposure to maximum infectivity, what is the time called as? What is that time called as? Generation time. See the words properly. Generation time. For example, today there is exposure. 10th day the patient will get fever. 14th day the patient is developing rash. Onset of rash, patient is highly infective. Onset of rash, patient is highly infective. What is incubation period? What is generation time? Answer my next question. What is incubation period and what is generation time? What is incubation period and what is generation time? Yes, good. 10 is the incubation, generation time is 14 days. Generation time is 14 days. Yes, good. 10 and 14. 10 and 14. 10 and 14. Yes, good. Gap between primary case, secondary case in the family. What is that interval? What is that gap called as? Answer my next question. Primary case, after 10 days, there is secondary case in the family. What is that gap called as? What is that gap called as? Serial interval. Gap, serial interval is nothing but incubation period of a disease. Always keep in mind, primary case will be the exposure, secondary case will develop signs and symptoms. This is indirect estimate of incubation period. So again my question is like this. A new disease will come. How to calculate incubation period? See the words properly. A new disease will come. How to calculate incubation period? A new disease will come, very like anything, any new disease will come. How to calculate incubation period? Yes, sir. Primary case, secondary case is very simple. Primary case means first case, secondary case means after that, which develop later. That is secondary case. Serial interval. Average of serial intervals will be an indirect estimate of incubation period. True or false? Average of serial interval is an indirect estimate of incubation period. True or false? True statement. Very good. True statement. Yes. Period of communicability means during which the agent will spread. During the time where the agent will spread. Non-communicable disease, we use one word, disease. After 10 years, if he is developing retinopathy, blindness, then the patient is coming. So the question is like this: increasing awareness, listen to the words properly, creating awareness in the system can reduce latent period of non-communicable disease. Tell me yes or no. Creating awareness in the system can help in reducing latent period. Tell me true or false. Creating awareness in the system can help in reducing latent period. Tell me true or false. True statement. Yes, good. True statement. True statement. Yes, correct. So, if I am asking one more question, if you are doing quarantine for contacts, if you are doing quarantines for contacts, which will help in quarantine? Incubation period or period of communicability? Which will help in quarantine? For contacts, if you are observing, I am asking. For contacts, if you are observing, which will help in quarantine? Incubation period. Quarantine is for maximum incubation period. Tell me true or false. Quarantine is for maximum incubation period. True or false? True statement. Yes, quarantine is for maximum incubation period. True statement. Isolating the patient is around period of communicability. Next question. Isolation is for the patient. Isolating the patient is during period of communicability or communicability period until the patient is communicable. True or false? Isolation is until the child is communicable, the patient is communicable. True or false? True statement. Good. See this epidemics. How to classify an outbreak? One wave, sharp rise, sharp fall, no secondary cases. All the cases which happened will develop within one incubation period. What is this type of epidemic called as? Answer my question. What is this type of epidemic? Means the exposure is single. All the cases will develop within one incubation period. No secondary waves. All the cases will develop within one incubation period. Exposure is single. Point source epidemic. Give some example. Very famous food poisoning. You'll be knowing the table, staph and all those diseases. Bhopal gas, methyl isocyanate, Minamata, methyl mercury exposure, all these contaminants which happened at one point of time if you are getting exposed to any leakage, Bhopal gas, methyl isocyanate, Minamata like methyl mercury poisoning, all this will come under one exposure epidemic, means one way will happen. Sharp rise, sharp fall. But if the source is continuous, again and again if you are getting waves, cases develop after one incubation period. Secondary waves present means there is something hidden. The source is hidden. Contaminated well, contaminated food stocks or vaccine stocks. If the question comes like this, contaminated grains, you are keeping it in the society, and if you are giving every week public distribution system, multiple exposure epidemics, food handlers, prostitutes, everything will come in this. Legionnaires disease. There was water fountain which was contaminated, spreading the illness continuously. Contaminated food stocks, vaccine stocks, well, prostitutes or Legionnaires disease, everything will come under multiple exposure epidemics. Multiple exposure epidemics. Either the source is single, one way will happen. If the source is multiple, multiple waves will happen. But if the question comes like this, person to person transmission, if they make this image for you in the class, or in the exam, if they give this image, person to person transmission, what is that epidemic which happened in case of COVID, polio? What is that epidemic called as? Tell me. Person to person transmission, slow rise will happen, slow fall will happen. In between, there is intermittent waves. You might have come across that word propagation, person to person transmission. This word will come. Person to person transmission, slow rise, slow fall. Slow rise, slow fall. Sometimes there will be a plateau in between, then it will fall off. Plateau is also very, very important. Herd immunity will help in reducing the propagation. Tell me true or false. Herd immunity will help in reducing the propagation. Tell me true or false. Herd immunity will help in suppressing the propagation. Tell me true or false. True statement. Yes, good. Herd immunity will help in reducing the propagation. Correct. So 1, 2, 3. I want everyone to type 3 numbers. 1, 2, 3. Numbers are very important in life. If you are feeding the brain what I have to remember 1, 2, 3, then it will recall it properly. Calm mind, sweetheart, or whatever you can tell. All these are very important. One by one, one by one. 1, 2, 3. Single exposure, multiple exposure, propagated epidemics. Propagated epidemics. Yes, 1, 2. This word will come, dot dots will come. One is spreading to one more. See this. National immunization schedule. Very, very important. National immunization schedule. What is this campaign called as? Mission Indradhanush. What is this campaign called as? Repeat. Mission Indradhanush. That campaign is nothing but related to vaccines. Related to vaccines. So this is the newer schedule what I am showing there. Newer schedule what I am showing there. At birth, we are giving 3 vaccines. Right, the mnemonic BOB, BCG, OPV, hepatitis B. BOB, BOB, BCG, OPV 0 dose and hepatitis B. Hepatitis B should be given within 24 hours. Hepatitis B should be given within 24 hours. Then comes 6, 10, 14 weeks. 6, 10, 14 weeks. All the states are using OPV and pentavalent. All the states in our country using OPV and pentavalent. Pentavalent 1, 2, 3. What should be the gap between 2 doses of pentavalent vaccine according to the schedule? What is your answer? What should be the gap between 2 doses of pentavalent vaccine according to the schedule I am asking? See the gap there. 4 weeks, very good. 6, 10, 14, 4 weeks of gap. Now comes selected states. Tell me 3 vaccines which are used in selected states. Tell the mnemonic. Rest in peace. RIP. Rest in peace. Rotavac, IPV, PCV. Selected states are using this. Rotavac, IPV, PCV. Rotavac 3 visits, 6, 10, 14 weeks. IPV also we have 3 visits now. 3rd dose at 9th month. PCV 1 and 2 along with this PCV booster. When is IPV 3rd dose given? Answer my next question. When is IPV 3rd dose given? When is IPV 3rd dose given? 9th month. Good. When is PCV booster given? Yes, good. When is PCV booster given? 9th month. So now rest in peace. Almost including boosters and everything, all are 3 doses only. Rota 1, 2, 3. IPV, that is fractional IPV what we use. 1, 2 and 3, 3rd dose. PCV 1, 2 and booster. So rest in peace. Okay, then listen. 9th month, most of the states have shifted to MR. MR first dose is given at 9th month. Very few states still they are using measles. Most of the states have shifted to MR. Along with that, vitamin A, 1 lakh international units. Japanese encephalitis first dose in endemic states is given at what age? Tell me. Japanese encephalitis first dose in endemic states is given at what age? This is my question. 9th month. Yes, good. 9th month. After 1 year, we are giving boosters. DPT first booster, OPV booster, measles or MR second dose, and Japanese encephalitis second dose. Some states they call it as booster. So listen, when is MR second dose given? 16 to 24 months. So how many doses of MR is there in the schedule? Answer my next question. How many doses? How many doses? Yes, 2 doses, MR1 and MR2. MR1 and MR2. Yes. DPT second booster, when it is given? Next question. DPT first booster is given at 16 to 24 months. When is DPT second booster given? When is DPT second booster given? 5 to 6 years. Okay, good. Adolescent age group, we are giving TD1, TD2. Adolescent age group, we are giving TD1, TD2. 2 doses of TD. 2 doses of TD. 2 doses of TD. Same thing in pregnancy. What will be the gap between 2 doses of TD? Repeat. In pregnancy, I am asking. In pregnancy, I am asking. What will be the 2 doses of TD vaccine? What will be the 2 doses of TD vaccine? 4 weeks. Yes, good. Any pregnancy within 3 years, the pregnant has to take. Yes, repeat. If the pregnancy happens within 3 years after receiving primary immunization, within 3 years if she is pregnant again, she has to take what? Booster. Yes, booster. Booster. So now my question is like this. If the pregnant is accompanying with a male child of 1 year age, pregnant should take booster or 2 doses? Repeat. Pregnant is coming with a male child 1 year of age. 1 year of age. Yes. 1 year of age. Booster. If the pregnant is coming with 5-year-old male child, next question. What you will do? If the pregnant is coming with 5-year-old male child, what you will do? Pregnant is coming with 5-year-old male child, what you will do? 2 doses again. 2 doses. Yes, good. TD. 2 doses. Yes. Japanese encephalitis, some states they are using live vaccine. Some states have shifted to killed vaccine. What is the strain for live vaccine? SCA 14-14-2, which is given subcutaneously. Killed vaccine is given intramuscularly. So if you know both, it is better, because last year question was on subcutaneous live vaccine. That is why. Subcutaneous live vaccine. If you know better, what is the route of administration of killed Japanese encephalitis vaccine? Repeat. What is the dose of killed Japanese encephalitis vaccine? The strain what we use is Indian Kolar strain now. Indian Kolar strain. Kolar is a district in our state. I am from Karnataka. Royal Challengers Bangalore. Good. This time they will not win one match also. Cup is different, totally different thing. Listen. Live vaccine subcutaneously, yes. Killed vaccine is given intramuscular, yes. Indian Kolar strain. Killed vaccine intramuscular. Yes, correct. Adverse effect of vaccines, they will repeatedly ask this question. Okay, good. Listen, BCG vaccine can cause suppurative lymphadenitis, BCG osteitis, and disseminated BCG infection. Disseminated BCG infection. Disseminated BCG infection. Underline this word. Disseminated BCG infection will present as fever, weight loss, and chest infiltrates. Listen to the words properly. If the child was given BCG vaccine, child is presenting with fever, weight loss, and chest infiltrates. What is the diagnosis? Answer is disseminated BCG infection. Always keep in mind, in BCG osteitis and disseminated BCG infection, we are using anti-tubercular therapy. How to manage disseminated BCG infection? If they ask, answer is anti-tubercular therapy. Anti-tubercular therapy. Measles, MR or MMR, the side effects are very, very important. Febrile seizures, thrombocytopenia, they will ask this question, encephalopathy, and toxic shock syndrome. How toxic shock syndrome will present? Fever, diarrhea, shock after 24 to 48 hours. Listen to the words properly. Fever, diarrhea, shock after 24 to 48 hours. Sometimes it can lead to death also. If they mention this word, fever, diarrhea, shock after 24 to 48 hours, death, then the answer is toxic shock syndrome. Toxic shock syndrome can be seen in measles, at the same time BCG, but mainly vaccine associated paralytic polio. Good. Vaccine associated paralytic polio is the side effect of which vaccine? Vaccine associated paralytic polio is the side effect of which vaccine? I am repeating, yes. Vaccine associated paralytic polio is the side effect of which vaccine? Oral polio vaccine. Why VAP can happen? Why VAP can happen in OPV? Because it is live attenuated vaccine. Live attenuated vaccine can cause vaccine associated paralytic polio. So OPV can cause VAP within those child who has received OPV if the child is congenitally immunodeficient. Yes, congenitally immunodeficient. Pertussis component, usually whole cell pertussis if you are using, can cause all these side effects: screaming, seizures. Hypotonic hyporesponsive episode is the side effect of which vaccine? Answer my next question. Hypotonic hyporesponsive episode is the side effect of which vaccine? HHE I am asking. Hypotonic hyporesponsive episode is the side effect of which vaccine? Pertussis component, yes. TT can cause brachial neuritis. Intersusception, very, very important. Rotavac can cause intersusception. Guillain-Barré syndrome, killed influenza vaccine. Repeat, what is the side effect of killed influenza vaccine? They'll repeat this question, they'll ask this question. It is Guillain-Barré syndromes. It is Guillain-Barré syndromes. Killed influenza, not live influenza vaccine. Intersusception will be the side effect of Rotavac. At the same time, intersusception, if there is an history of intersusception, listen to the words properly. History of intersusception, which vaccine is contraindicated? History of intersusception, which vaccine is contraindicated? They'll give this question. The child is coming, the mother is bringing the child with an history of abdominal surgery or intersusception directly. Which vaccine is contraindicated? Answer is Rotavac. Good. 17D vaccine is live attenuated yellow fever vaccine. Tell me true or false. Next question. 17D is Live attenuated yellow fever vaccine. Tell me true or false. True statement. It can cause symptoms similar to yellow fever. What is that called as? Vaccine associated viscerotropic disease. Live vaccine which can cause symptoms similar to yellow fever, that is 17D. That side effect is called as vaccine associated viscerotropic disease. Vaccine associated viscerotropic disease. So what was the thing what we discussed in this slide? Tell me. What was the thing what we discussed in this slide? Side effects. Yes, very good. Side effects. Delayed immunization, very important question. Till 1 year, what vaccines can be given? Answer my next question. Till 1 year, what vaccines can be given? Delayed immunization I am asking. Till 1 year, what vaccines can be given? BCG, pentavalent, Rotavac, IPV and PCV. Rest in peace till 1 year. Rest in peace till 1 year. 18th month old child. Listen to the question properly. 18th month old child. Pentavalent vaccine can be given. First dose of pentavalent vaccine can be given. True or false? 18th month old child. First dose of pentavalent vaccine can be given. True or false? First dose of pentavalent vaccine can be given. True or false? False statement. You cannot give pentavalent. They will ask this question. Till 5 years. OPV, measles or MR. This is routine immunization age limits what I am telling. Till 7 year DPT can be given. Till 7 years pertussis component can be used. And endemic states, they might ask this question. As of now, not asked. What is the upper limit for routine immunization for JE? If they ask, it is 15 years. It is 15 years. This is age limits. I want you to type 3 words for me, 3 numbers for me. 157. Type this number in the chat box. Good. 157. 157. Usually we ask question on pentavalent for you most of the times. 18th month old child, 2-year-old child, like that we give. 157. Vaccine while monitor. You can see the image there. Easiest question in the exam. Don't make mistake. Vaccine while monitor. Vaccine while monitor will help in indicating heat exposure. Always keep in mind. Will help in indicating heat exposure. So how many stages are there? Stage 1, 2, 3, 4. Stage 1, 2, 3, 4. Stage 1 and 2, the central square is lighter than the outer circle. If I am highlighting this vaccine vial for you, what is this stage? Both are lighter, but you should know how to identify stage 2. Stage 1 and stage 2, there is slight difference. You can see there. The central square is lighter than the outer circle in both stage 1 and stage 2. Vaccines can be used in what stages? Vaccines can be used in what stage? Stage 1 and stage 2. Stage 3 you cannot differentiate. Stage 3 you cannot differentiate. It becomes equal. When they highlight this vaccine vial monitor for you, what is this stage? 3. Equal. Stage 4 is darker than the outer circle. Vaccines should not be used in stage 3 and 4. Vaccines should not be used in stage 3 and stage 4. Very easy question. Don't make mistake. It is like full toss. Full toss, it's very difficult to hit nowadays. Half volley I am telling. If the ball is in your zone, half volley, and if you are trying to hit something like helicopter shot by mistake, if it happens, if it is right in the exam, good, nothing will happen. If by mistake, if it is wrong in the exam, you'll start panicking. Don't worry, one or two questions, silly mistakes will happen in between. Nothing to worry. VVM is very easy, easiest question. Everyone should mark it correctly. Everyone should, in the slot I'm telling, yes, good. I missed that word, slot. Rather than telling full toss, I'm telling the slot. VVM is like slot question. You have to get it correct. 1, 2, you can use it. 3, 4, you cannot use it. They'll mention this. If they mention this while for you, if they mention this while for you, what is this stage? Yes, RCB bowlers. Instead of writing slot, you can write bracket RCB bowling. RCB, Siraj or whatever. Every bowler come to RCB will become the same thing. They'll take like your hours. That feeling is there with RCB. Now every bowler will become the same one. Later there is no difference only. Stage 4. Stage 4. Yes, good. What test is used to indicate freeze damage? What test is used to indicate freeze damage? What test is used to indicate freeze damage? I'm asking. Shake test. Yes, shake test will help in only heat exposure. VVM will indicate only heat exposure. Open vial policy. If the vial is open, something is left out, you can use it for next session. 4 weeks tak you can use it. That is why I mentioned date and time. So date and time should be mentioned. VVM should be intact. Always keep in mind, date and time should be mentioned. VVM should be intact. Open vial policy will help in reducing vaccine wastage. True or false? Open vial policy will help in reducing vaccine wastage. True or false? Open vial policy will help in reducing vaccine wastage. True or false? True statement. That is why I mentioned date and time. Open vial policy is not applicable for, means we have to use it in the same day. You cannot use it next day. Tell me the mnemonic. British Medical Journal. Japanese encephalitis live vaccine. Keep this in mind. BMJ. Japanese encephalitis live vaccine is diluted. So whatever you are diluting, BCG, measles or MR or JE live, if you are diluting, you have to use it within 4 hours. You cannot use it in the next session. You cannot use it in the next session. Covishield, Covaxin, when we had COVID pandemic, during that time when we manufactured, there was no VVM. So since we are not having VVM, the condition is very important. VVM should be intact. Since there was no VVM, this cannot be used in the next session. Even rabies, yellow fever, all these are diluted only. Yes, what you are telling is good. These vaccines, it is not applicable. So MR vaccines, JE vaccines, yes, listen. These JE live I am telling, vaccines cannot be used in the next session. Applicable to Rotavac, JE killed. Remember this. Rotavac, we have multi-dose vials now, so it is applicable. Before it was single-dose vial. Now we are having multi-dose vials. I don't want you to waste it, so you can use it. Rotavac. JE killed is not diluted. It is liquid, so you can use it in the next session. Other than that, every vaccine you can use it. Now my question is like this. Half used MR vaccine, half used pentavalent vaccine. Came back to the health center. What you can use, what we need to discard, or what cannot be used. That will be the question. Pentavalent you can use it. MR we cannot use it in the next session. MR we cannot use it in the next session. Good, good. Underline that word, Rotavac and JE killed. These two things you should know. Rotavac and JE killed. Very good. So much of energy. Tomorrow, if they give exam, you will. I think you will give exam. I think that much of energy is there within you now. I don't know from where that energy is coming for you. Tomorrow, if they give, no, they won't give tomorrow exam and all. They'll make it on the same date. Nothing to worry. Exam will be on the same date. Prepone, postpone, mocktail, cocktail, they will make somehow in between, but this time they won't make anything more, I think so. Listen, underline this word. No, sir, I need some time, sir. Yenu gottilla, sir, I need to revise, sir. Revision is very important. If you start revising things, If you are having one schedule, if you keep on routine, always I say three words: schedule, notes, revision. Schedule, notes, revision. So fine, good. Yes. Listen to the words properly. Study designs, very important topic. Study designs, very important topic. If there are atypical diseases, listen to the words properly. Atypical disease, new disease will come. Atypical disease, new disease will come. Atypical disease, new disease will come. We usually do descriptive studies, case study and case series. Case study and case series. Case study means one case if you study, that is case study. Case series means multiple cases. Multiple cases. Both will be coming under, listen, both will be coming under descriptive study. Both will be under descriptive study. Descriptive studies will help in, descriptive studies will help in, listen to the words properly, descriptive studies will help in formulation of new hypothesis, true or false. Next question. Descriptive studies will help in formulation of new hypothesis, true or false. True statement, yes, very good. They will help in formulation of new hypothesis, yes. A 10-year-old child present with atypical rashes and fever. What is this? Repeat my words. A 10-year-old present with atypical rashes and fever. What is this called as? And respiratory distress. If I am adding one more word to that. A 10-year-old child presents with atypical rashes all over the body, fever and respiratory distress. Case study. Okay, good. Very good. 3 to 4 cases of pneumonia of unknown etiology was reported from Wuhan, China. 3 to 4 cases of pneumonia of unknown etiology was reported from Wuhan city, China. Case series, yes, good. Means you are studying only cases. Comparison group will not take. If I say 3 cases and 3 healthy individuals are studied, means comparison group taken. What is that study? Study will be different. वो तो अलग हो गया ना. Words English है. Case and controls. हाँ, good. 3 deceased individuals, 3 healthy individuals. Then it will become what study? Case control study. Very good. The difference between case series and case control study is there in the comparison group. Very good. Comparison group. Very good. Study was done at one point of time, going to class, checking the prevalence of refractive errors. What is that study? When you are making one pie chart like this, going to class at one point of time, checking the prevalence of refractive errors. What is this study? Cross-sectional study. Cross-sectional study. Cross-section English है. Cross-section मतलब at one point of time. Everything is English in PSM. PSM is more of English words only. All the books are written by US, UK people. Their mother tongue is English only. They'll be talking like this only. Their way of talking is like this only. Mother tongue, you know, English. Incidental finding, it will be prevalent in my locality. You'll be quarantined if you don't bring this level of English they speak. For us, that will become MCQs. Because our mother tongue is totally different. That culture, that diversity. So when I ask this question, quarantine, students start crying. मतलब in YY if I ask questions like quarantine, suddenly they will start crying. Sir, first time spelling है गोतिला sir. मतलब spelling. See, always remember, don't panic when you read the words. It's very easy words. Incidence, prevalence, quarantine, all these are words. You should not have that fear. You should feel that it is mine. That feeling should come. You have to hug the words, then it will become very easy for you. Now tell cases and comparison group if you take. Along with cases, if you take controls, healthy individuals are studied. Healthy individuals are studied. What is that study where you take comparison group? Very important. Yes, good. Answer my question. Cases and controls, yes. Comparison group is taken. Case control study. If there is a case 29-year-old male, if you take control in the same way, 29-year-old male, what is this procedure called as? Answer my next question. Case 29-year-old male, if you take controls in a same way, 29-year-old male, what is that procedure called as? Matching. Yes, you are matching for age and sex. Tell me true or false. In the example given, you are matching for age and sex. Tell me true or false. You are matching for age and sex. Tell me true or false. True. So matching will increase the quality of comparison. Next question, true or false? Matching will increase the quality of comparison. Tell me true or false. Yes. Matrimonialshadi.com is different. Don't read bracket matching shadi.com or Bharat Matrimony and all. That is totally different. That matching is total. Nobody can match anyone to anyone. That is destiny. Could underline this word. Matching will help in removing non-confounding factors. Matching will help in neutralizing the effect of non-confounding factors. Tell me true or false. Matching will help in neutralizing the effect of non-confounding factors. True or false. Matching will help in neutralizing the effect of non-confounding factors. True or false? True statement, yes. After doing matching between two groups, if you take case, then you take control, you did matching. What is the next thing you have to do? You have to do a study. Study means we take history of exposure. Tell me true or false. Study means we take history of exposure. Tell me true or false. Study means history of exposure. Smoking, alcohol, like that we take. Tell me true or false. True statement. So if you are taking past history of exposure, the study is retrospective. Tell me true or false. The study is retrospective. Tell me true or false. You are taking past history, or you are a smoker, like that you are asking. It is retrospective assessment. Yes, good. Retrospective assessment. Bias can happen. Again and again you are asking one group. If you are there, if you are an interviewer, if you are a doctor, again and again you are asking case. Are you a smoker? सोचो एक बार सोच के देखो, पीछे जाओ, पीछे जाओ मतलब when you were there, when you were young, when you were adult, like that, when you married, something like when you had stress and all, you are giving more time to the group. One group you are asking again and again. सोचो सोच के दिखाओ, पीछे तो देखो, मतलब इतना टाइम if you are giving. What is this bias called as? पीछे तो देखो what is that bias called as? Interviewer bias. Interviewer is doing that bias. He is thinking that smoking can be the risk factor and smoking was present. That is why he is asking them. Again and again you are poking. सोच के दिखाओ, सोचो एक बार, जाओ पीछे, कितना पीछे जाएगा यार, वो भी ना. दोनों तरफ सेम लेवल पे पूछना है, मतलब इक्वल इंटरव्यू टाइम यू हैव टू गिव कैन रिड्यूस इंटरव्यूअर बायस. टेल मी ट्रू और फॉल्स. Equal interview time can reduce interviewer bias. Tell me true or false. Equal interviewer time or equal interview time can reduce interviewer bias. True or false? True. Even if you ask history in the same way, still there is a difference between these two individuals. Same way you are asking history. Are you a smoker? Who will try to think more comparatively? I am asking. That might happen. Who will try their level best? Who will try means who is already emotionally down, already having weight loss, fever, chest pain, cancer symptoms. Who will try to think more? That differential recall can happen. Cases will try to think more comparatively. Usually, it will happen. They will try to think more because they are having disease. Just one question if you are putting, are you a smoker? Case is going back like anything. Going, why me? That feeling is there, na? He's going back, long back, and he's telling that history. Sir. One cigarette, I can remember now. I had one cigarette just after the exam, maybe whatever the exam he has taken. After that, I had once that extra effort is putting. This is recall bias. Tell me yes or no. Cases हाँ एक पी थी, हाँ वही तो मैं बता रहा हूँ ना. ठीक है, एक ही तो छोटा सा सिगरेट, एक पफ या दो पफ मारा होगा बस, पोपो करके. हाँ गुड, पोपो और वट एवर, फुक फुक और वट एवर दैट. हाँ गुड. Cases will try to recall the exposure more, they will try to recall the exposure more compared to controls. This is recall bias. Tell me yes or no. Case control studies will have recall bias. Prospective studies will eliminate recall bias. Tell me true or false. Next question. Prospective studies will eliminate recall bias. True or false? Prospective studies will eliminate recall bias. True or false? True statement. Yes. After doing 1, 2, 3, 4 step, then we calculate odds ratio. What is the formula for odds ratio? Exposure assessment we do, cross product we take. What is the formula for odds ratio? ED by BC. ED by BC. It is cross product. Odds ratio is also known as cross product ratio. Tell me true or false. Odds ratio is also known as cross product ratio. If it is more than one, positive association. If it is less than one, negative association. If it is more than one, positive association. If it is less than one, negative association. Now tell odds ratio 0.6. What type of association? Positive association or negative association? Odds ratio 0.6. Positive association or negative association? Negative association. Odds ratio 1 means what? No association. Odds ratio cannot be 0, na? Either it can be infinite. I have never seen odds ratio 0. 0 means you are not doing anything. Good. 1 means no association, less than 1, more than 1. Negative association, positive association. Total 5 steps in case control study. Yes, good. Now if the study is like this, smokers, non-smokers. Smokers, non-smokers. You are going in a forward direction. You are calculating incidence in exposed, incidence in non-exposed. Doing follow-up. Now tell me, what is this study? Doing follow-up. Yes, good. Doing follow-up. What is this study? Prospective cohort study. Yes. If you start from 2024, you are going till 2044. This is prospective cohort study. What you get from cohort study? Incidence. Yes, good. What association is proved? Answer my next question. If I am telling 3 words, I, T, R, what association is proved? First tell me. I for incidence we get. T for what association? Temporal association. Very, very good. Temporal association. R means what? Bias is eliminated. What bias is eliminated? Recall bias is eliminated by doing a prospective study. Yes, good. Loss to follow. Dropouts can happen in between. What is that bias called as? Dropouts can happen in between. 20 years, no? They won't guarantee. Daily you are going and asking what happened and all. Suddenly they will switch off their phone. Someone will go. Suddenly is from Bangalore is going to Delhi. He's not switching on. You are not switch off phone. What is that bias called as? Attrition bias is seen during follow-up. Attrition bias. Change in behavior is different. That is Hawthorne effect. Change in behavior is different. or Thorne effect is change in behavior. After doing cohort study, analysis will happen. We calculate what ratio for strength of association. Tell me the basic word. What ratio is for strength of association? Tell me. What ratio is used for? Risk ratio. Very good, risk ratio. If you are doing study with the help of existing records are used. Follow-up is done with the help of records. Incidence only you calculate. All these words will come. That is what study? Tell me. If you are starting from 1994, checking the records 2024, using and calculating risk ratio, what is your study? Record from 1994 you are checking. Going to a factory, checking the records, what has happened, periodic health examination is done. Using same incidents only you do. What is that study called as? Retrospective cohort study. Will help in saving time and cost. Tell me true or false. Retrospective cohort study with the help of existing records. Follow up with the help of records only. Yes, good. Will help in studying or will help in saving time and cost. Yes, good. That is retrospective cohort study. When you mix both retrospective component plus prospective component later, that is ambispective cohort study. Ambispective means both. 2024 you are having something like COPD and you are continuing till 2044 to check what will be the progression. You are having both the component. That is ambispective, means amphibian like, two things together. First you do retrospective in the same study subjects, you continue and do prospective, because you are having too much of time with you, na? Matlab you are having too much of time with you, you want to do something, then along with the records, that will not take much time, then taking the same individuals, that level of determination is there with you. That is ambispective cohort study. Salute, good, very good. So listen to the words properly. 1, 2, 3, 4, 5. What ratio is used to calculate strength of association in cohort study? Answer my next question. What ratio is used to calculate strength of association in cohort study? What ratio is used? Cohort study I am asking. Risk ratio, very good. Now listen. Case control is effect to cause. We compare exposure. Studies only retrospective. Which is easier to conduct? Which is very cheap? Answer my next question. Which is time saving in between case control cohort I am asking. Which is easier to conduct? Which is very cheaper? If you don't have any time, if I want to know association, case control study, yes. Cohort is like this. Forward direction, incidence can be either prospective or retrospective. Prospective cohort will take time and cost. Which is consuming more time, more money? Answer my next question. Which is consuming more time, more money? Yes, good. Always cohort will take more time and more money from your side. Yes. Now the question again will come like this. Listen. If you go back and study, which study will help in studying multiple exposure? See the words properly. Which study will help in studying multiple exposures for a disease? Taking one patient, asking so many things. Which study will help in studying multiple exposures? Case control study, because the study is going in a backward direction. You can ask history of so many risk factors. But if I want to know multiple outcomes, follow-up should be done. Multiple outcomes can be studied by cohort study, true or false? Multiple outcomes can be studied by doing a cohort study, true or false? Cohort study, true statement. Rare disease, always keep in mind, this question will come in the exam. Rare disease, which study is preferred? Cohort will take time. Don't do study like rare disease. Don't commit cohort study. Rare disease association. Which study is preferred? Case control study. Case control study. Yes, very good. Recall bias in case control. Odds ratio in case control we have discussed. Attrition bias in cohort. Risk ratio in cohort. What is the formula for listen to the words properly. What is the formula for risk ratio? See the words properly. What is the formula for risk ratio? If I am asking ratio, two things we have to divide. What is the formula for risk ratio? Yes, incidence in exposed by incidence in non-exposed. If I am asking like this, incidence in exposed is 10 per 1000. Incidence in non-exposed is 1 per 1000. What is risk ratio? Answer my next question. What is risk ratio? Incidence in exposed is 10 per 1000. Incidence in non-exposed is 1 per 1000. What is risk ratio? Risk ratio is 10. 10 by 1 it is 10. Very good. So exposed group is having 10 times more risk of developing cancer compared to non-exposed group. True or false? Risk ratio means relative risk. You are comparing between two groups. Exposed group is having 10 times more risk of developing lung cancer compared to non-exposed group. True or false? True statement. If the word comes 10 times more risk, 20 times more risk, that will indicate strength of association. Risk ratio, also known as relative risk. Relative risk. If it is more than 1, what type of association? Answer my question. Risk ratio is more than 1. What type of association? Answer my question. If it is more than 1, what type of association? Positive association. Good. Positive association. Now come to the word attributable risk in proportion. If I am telling the whole thing into 100, 10 minus 1 by 10, how much percent you are getting? Answer my question. How much percent you are getting? Substitute the value. Exposed minus non-exposed by exposed. Yes, good. 90%. 90% means out of the total outcome, 90% you can attribute to smoking. For example, if I am taking the exposure as smoking, 90% of the cases will be due to smoking. The remaining 10% is due to other factors. So among exposed group, whatever the cases which is happening, 90% is due to smoking. Remaining 10% is due to other factors. If I bring all the smokers to one room, एक कमरे में उसको बंद कर दिया मैंने, उसको बोलो प्लीज आ जाओ, मतलब प्लीज जो भी इंसेंटिव्स देके उसको एक कमरे में बंद करो. Start counseling them like anything. Stop smoking, stop smoking. They stopped smoking. After they stopped smoking, if you are eliminating the risk factor, yes, all 100% of the cases can be prevented. True or false? All 100% of the cases can be prevented. True or false? All 100% of the cases can be prevented. True or false? False statement. How much percent of the cases can be prevented? 90% of the cases can be prevented because 10% is due to other factors. 10% is due to other factors. Yes, good. Means attributable risk can indicate how much of the disease you can prevent among exposed group if the exposure is eliminated. Tell me true or false. Next question. How much amount of disease can be prevented among exposed group if the exposure is eliminated? Tell me true or false. Tell me true or false. True statement, yes. So attributable risk can indicate preventable component among exposed group. Preventable component among exposed group, true or false? Attributable risk can indicate preventable component among exposed group, true or false? True statement. See the formula for population attributable risk. They won't ask calculation for you. Incidence in total population will come. What is the difference in the formula? See the formula. See the formula. What is the difference in the formula? In place of exposed group, you are putting total population. See the formula. In place of exposed group, you are putting total population. That means what is the advantage for the whole population? Not just for the exposed group. What is the advantage for the whole population? The whole state, how much advantage you will give? That is given by population attributable risk. Always when you are making any public health measure, we always think about the whole population. Out of all this, 1, 2, 3, which is most important for policy makers? Answer my next question. See the mnemonic RAP. Which is most important for policy makers? Population attributable risk. Population attributable risk. So type the mnemonic RAP. Risk ratio, attributable risk, population attributable risk. Wrapping. Yo, Anis Singh. Wrapping. Where is that wrapping emoji? I am not getting. Anyone is getting that emoji of wrapping? You can send me here. I'm searching for that emoji because this is my favorite mnemonic. Wrap. Yo. Next, listen. RCT. RCT. Population. This is the word reference population. Out of that, we are taking a sample. Out of 1000 patients, 100 patients are selected for the study. 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 Now tell me, what is this first step called as? Out of 1000 patients, 100 patients are randomly selected for the study. What is this first step called as? Okay, like this we do for wrapping. Okay, I didn't know this. Just one more thing I'm learning now. Good. Yo, wrap. Risk ratio, attributable risk, population attributable risk. Very good. See this step. Random sampling. Everyone is having equal chance of selection. It will reduce selection bias during selection of study subjects. True or false? From 1000, if you are selecting 100. Random sampling. Okay, good. Listen. Out of 1,100 patients are randomly selected for the study. It will reduce selection bias during selection of study subjects. Tell me true or false? True statement. Very, very important word. After selecting 100 in the group, 50, we divide them into two things. 50 will get new drug, 50 will get placebo. This is random allocation. Random sampling. Second step is random allocation, also called as randomization. What is second step called as? Answer my next question. Type it in the chat box. What is second step called as? Random allocation or randomization. Allocating means giving. 50 इधर आ जाओ, 50 इधर आ जाओ, मतलब उधर चले जाओ, जो भी है आ जाओ मतलब इधर रुको उधर रुको. 50. Listen to the words properly. Random allocation or randomization will reduce selection bias during treatment allocation. True or false? See the words proper. Random allocation will reduce selection bias during treatment allocation. True or false? Very good. True statement. So step 1 is different, step 2 is different. Always keep in mind. First we take, then we give. First we sample, then we give, then we allocate. It is the life policy. First take, then give. Take and give. Or whatever. First we take sampling, then we allocate. Random allocation, randomization. So see the words properly. From 1000, 100 patients are randomly selected. This is first step. Random sampling. Tell me true or false. This is first step. From 1000, 100 patients are selected for this study. Tell me true or false. From population we are selecting sample. From population we are selecting sample. True statement. True statement. Yes, very good. Whatever the sample you are selecting will represent the reference population. See my words properly. Whatever the sample you are selecting will represent the reference population. Oh my god, English. Represent the reference population. True or false? True statement. Yes. Sample what you select will represent the reference. Oh, easy है भाई, इतना easy हो गया. Easy है, nothing. Sample what you are selecting is representing reference population. Yes, good, correct. So whatever the results you are getting from this sample will be generalized back to the reference population. Whatever the results we are getting from this sample can be generalized back to the reference population. Can be generalized back to the reference population. Tell me yes or no. Yes. What is this generalization called as? What is one more word given? What is the word given to this? Generalization of results to the reference population. What is the word given to this called as? One more word they are giving just to make it look better. Very level. Matlab, generalization is one level. External validity is very level. Matlab next level thing what they are giving very level. External validity. Matlab it will look good. When we are speaking generalization, it looks chutti, but when you are telling the word external validity, oh my god, again one more word. Very, very important. One mark, what you are collecting is very, very important. It's like taking singles. In between, if you are collecting some good score, external validity, repeatedly asked question. Tell me true or false. External means you are going back and generalizing the results. No? That is what is the word external. Tell me true or false. Random sampling will increase external validity of the study. True or false? Random sampling will increase external validity of the study. True or false? Random sampling. Correct. Random sampling will increase external validity of the study. True or false? True. What is the next step? What you are doing is called as randomization. When everyone was having equal chance of receiving either new drug or placebo. So that will eliminate selection bias during treatment allocation. Randomization will eliminate selection bias during treatment allocation. Whatever the results you are getting is correct. There was no selection bias. You are not doing any selection bias during treatment allocation. Results will be applicable within the study subjects. What is this within called as? Answer my next question. What is this called as? Results will be applicable within the study subjects. What is this called as? Internal means olage, within that, अंदर. एक हो गया अंदर, दूसरा बाहर. अंदर बाहर वो गेम है ना, कुछ अलग है. That is different. अंदर बाहर is totally different from this. मतलब almost related to this. Going back and generalizing is external validity. Within is internal validity. Okay. Internal. Yes, very good. Siddharth Parik. Slowly Siddharth Parik is becoming Dinesh Karthik for me. He is my finisher. Everyone is... no sir, I don't want to play for RCB. That is his reply actually. I don't want to play for RCB sir. Underline this word. Tell me true or false. Again, match the following. Random sampling will increase external validity and randomization will increase internal validity. Tell me true or false. Random sampling will increase external validity and random allocation or randomization will increase internal validity. Internal validity. Yes, correct. Will you agree on this? Tell me yes or no. Yes, sir. Thank you. Good. Last slide. We will take a break now after crossover RCT. Crossover RCT. phase 1, phase 2. There are two phases in crossover RCT. There are two phases in crossover RCT, phase 1 and phase 2. First group will get new drug, second group will get placebo. After a gap of 15 days or 1 month, we interchange. First group will get placebo, second group will get new drug. What is this RCT called as? Keeping a gap and interchanging this. What is this RCT called as? Yes, strategic timeout. Not break, we will take like strategic timeout. ब्रेक मतलब लंबा होता है ना, स्ट्रैटेजिक टाइम आउट मतलब छोटा होता है, इसमें चल जाता है मतलब क्या क्या करना है, क्या क्या कौन नो बॉल करेगा, कौन आउट करेगा, वो सब अलग बात है, तुम आगे बोल नहीं डालो. व्हाट इज दिस टाइप ऑफ आरसीटी कॉल्ड एज? अंडरलाइन दिस वर्ड. फेज 1, फेज 2, फेज 1, फेज 2. In between there is a gap, wash out. All the residual effects should be washed out. All the residual effects should be washed out. All the residual effects should be washed out. Remember this, important. That is washout period. Washout period. Yes, correct. Then we interchange. This is crossover RCT. First tell me the advantage. First tell me the advantage. First tell me the advantage. Every patient will get that new drug, so it will reduce ethical problems. Tell me true or false. Every patient will get new drug, so it will reduce ethical problems. Tell me true or false. Every patient will get new drug, what is being studied, so it will reduce ethical problems. True or false? True. Very good. Very big advantage is within patient comparison can be done. The same patient is using that drug. In the second phase, the same patient will be using placebo. Within patient, the same patient will act as his own control for analyzing the difference. Tell me true or false. Yes, very good. Same patient will act as his own control for analyzing the difference. Within patient comparison can be done in crossover RCT. True or false? Within patient comparison can be done in crossover RCTs. True or false? True statement, yes. But very important thing is, it is not preferred for acute conditions. What is the reason? Think and tell. If the patient is getting cure in phase 1 itself, the same patient will not be there in the trial because already the patient has got cure. So this is not preferred for acute conditions. This is not preferred for curative drugs. Always keep this in my mind. This is not preferred for curative drugs. Common sense, if the patient is getting cure, no point in keeping the same patient in the trial. Patient already received, patient already, yes, got cure. That means it is preferred only for what conditions? It is preferred only for what conditions? Chronic stable conditions. Give some example. Give some example. It is preferred only for chronic stable conditions. Give some example. Not for surgical intervention. Yes, correct. Very good. Chronic stable conditions. Diabetes, hypertension. Yes. Diabetes, hypertension. You can compare the blood sugar levels. You can compare the asthma episodes. Yes, very good. What are the three things there in the notes? I think I gave 3 examples for you. Diabetes, hypertension, asthma. Asthmatic episodes can also be compared. You can compare the asthmatic episodes between phase 1 and phase 2. Tell me true or false. You can compare the exacerbation asthmatic episodes between phase 1 and phase 2. Tell me true or false. True statement. Very good. Understood what is crossover RCT? Tell me yes or no. Understood what is crossover RCT? What is the advantage? What is the limitation? For which conditions it is preferred?